There are more deaths in Bombay, people dying from falling off local trains because they are so overcrowded or while crossing tracks than from any terror attack that has ever happened, right? So even those simple risks are much higher, leave aside many others, right?
We have a huge concentration of people living in a small area with no proper sanitation, no clean water. Urban people have to go to work early in the day, come back late in the night. We have children to feed, living in a small 10 feet by 10 feet kind of setup.
ये सबसे बड़ी दीदी है मेरी। अच्छा, और ये इनकी बेटी है।
खुद आती नहीं किसी की गोदी में।
So if I was describing, say for example, a person who is earning say 10,000 rupees a month in a family whose total income is 15,000, imagine that person going away from the family. It's just 2/3 of the income is gone, right? And that's what's happening, because that's how people from above poverty line, in the so-called definition of above poverty line, which is being debated, even if people who are above that come below it because they have lost a member.
Hi, my name is Sita Santosh Singh.
और आप क्या?
I am doing nurse work and Swasth Health Center.
And how long have you worked with Swasth?
कितनी देर से काम कर रहे हो स्वास्थ्य के साथ?
9th month.
9 months. Yeah. So she was part of the first center, right?
हाँ, तो आप सबसे पहले सेंटर में?
Yes, yeah.
Okay.
लास्ट में हमारा लाइक अच्छा होते गया, फिर बाद में और हमारी लाइक बिगड़ गई। हस्बैंड हमारा पागल हो गया। तो यह हमारी बहुत कुछ कहानी है ऐसी। तो हमने दुख पालते 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 हमारा एक लड़का था, वो लड़का भी हमारा 10 साल 12 साल हो गया, वो भी हाफ हो गया। आया तो आगे, अभी ये बेटी लोग का टेंशन है, अभी बेटी लोग का सुख दुख है, अभी उनको ही साथ देते देते हमारी जिंदगी कायम हो रही। तो ऐसा हमारी लाइक हो गई। तो अभी आगे क्या है पूछो तो बताती।
अपने लाइफ में इतना कुछ देखा है।
हाँ, काम पे गई थी, अचानक पेट में दर्द होने लगा। मैंने कंट्रोल करने का कोशिश किया था, मेडिसिन दिए थे डॉक्टर सर ने, मैंने खाया था, मेरे से कंट्रोल नहीं हो रहा था। गवर्नमेंट हॉस्पिटल में लेके गए तो वो लोग बोले आपको सोनोग्राफी करना पड़ेगा। तो सोनोग्राफी किए तो सोनोग्राफी वाले डॉक्टर ने बताया कि आपको अपेंडिक्स है। वो लोग बोले हमारा इधर सिद्धार्थ नगर में गोरेगांव में नहीं होता है, तो आपको बांद्रा नहीं तो केएमबीएम जाना पड़ेगा। तो मैंने घर पे आए, क्योंकि उधर जाने का मतलब सब सामान तो साथ में लेके जाने का, गवर्नमेंट में उधर कुछ मिलता है। तो इसके लिए घर पे आए तो मैंने संदीप सर को फ़ोन लगाया सर को फ़ोन लगाया तो सर क्या बोले, हम लोग ने हॉस्पिटल जो जॉइंट किए ना स्वस्थ हेल्थ सेंटर के लिए,
You know, sometimes in a busy hospital, government hospital, which is flooded with patients coming in, and the number of doctors are less, then the time that you spend in trying to explain to people what the problem is limited, and so after a point of time, people don't use it. So, but somebody who has nothing, then they just are willing to accept all this and still land up at a facility.
Due to the lack of doctors and because of the lack of good hygienic conditions, people shy away from public institutions. The people go to private providers, even though they are more expensive. But what we have seen when we moved around was private providers, they tend to abuse not only on the monetary front but also on the quality.
So there is no insurer, there is nobody, the people are paying, and that's what results in this sort of poverty trap due to health.
The people who are employed tend to have their insurance schemes funded by their employers. Otherwise, nobody else buys an insurance scheme. So where do you fund your expenses from? Either you dig deep into your savings, but then these people have almost zero savings, or you sell off an asset. If you have assets, well and good. But then again, health shocks come at a time when you're not prepared. It's not a pre-planned expense, right? So you have somebody has an accident and you sort of suddenly need money to pay for it. So you can't sell off your land in a night. And so when people get caught in this trap where they have to borrow money from a money lender, so they get caught in what is called a poverty trap. They can't even pay back the interests because the interests are so high.
Government have so many health initiatives. They have so many schemes for pregnant women, for children below 3 years, 6 years. Then they have programs for adolescent girls and boys also. You see, if you see the programs on the paper, it looks very good. But when the time comes of implementation, it is not satisfactory. Government makes the program in a central places like Delhi and Mumbai, and they send these things to the people who are working in the villages. Many of the times they don't understand what is the real situation in the village. So, and they are not participated this program with the community. It's like a force program, so it doesn't work.
well, you see, as far as India is concerned and the way the Constitution looks at it, we are committed to provide healthcare for all. But I think by far and large, still in the government sector, I think there has been tremendous improvement in the way healthcare delivery is beginning to happen. So I think in terms of manpower, in terms of quality, in terms of availability of diagnostics, in terms of making drugs available at affordable costs, there are now many states which have pharmacies in the campus of the hospital which provide generic drugs at very base cost.
India's public system operates on a universal healthcare model, meaning that care is heavily subsidized by the government or possibly free for patients who use their facilities. Some treatments or services will cost a patient. For example, drugs from the hospital pharmacy are not always free. Healthcare programs are run by individual states, while the central government in Delhi funds several programs that are nationally important. Government facilities include primary, secondary, tertiary, and ambulatory care. Running parallel to the government system is a popular private care industry, and many who can afford it will use these facilities to avoid the perceived quality issues in government hospitals.
Most people who utilize the system come from poor sections of community. And a fairly large number of people come from outside the national capital region of Delhi. They come from as far as Bihar. They come from all the adjoining states for treatment over here. Part of the reasons is that, as I said earlier, that everything is free here.
Is it expensive for them to come so far?
Well, I don't know. It's like this. Probably it's cheaper for them to pay the cost of travel and pay nothing for healthcare. Even though I know that when they come back from there, they do have economic losses. At the end of the day, you have a patient who becomes better and survives. And I think that's a critical issue.
Swasth in Hindi means healthy. So Swasth India by the very word means healthy India. Our mission is to work for a healthier India. So our mission is to again work with the low income people.
So let's start with talking about what Swasth's mission is.
Swasth's mission. So Swasth's mission is to improve the health of low-income households, both in urban slums as well as rural India. Our goal right now, we've set ourselves a goal of reaching 15 million lives by about 2020. So what we are trying to do is to create an integrated health system. By integrated, I mean it covers all aspects of health, right from preventive care, primary services, secondary and tertiary. And the second aspect of the model is to make it self-sustaining, so that people pay themselves for this, but pay a reasonable amount. So we don't want to rely on subsidies or grants, but make it a self-sustaining, integrated health system.
Swasth India Services was founded as a way to provide health insurance to low-income families. It quickly grew to encompass many deeper elements. Swasth's insurance policy provides a 50% copay on services and drugs. Swasth partners with nearby hospitals to offer its insurance plan. Swasth also operates multiple health centers. Each center includes a doctor, nurses, and diagnostic equipment. Beyond the centers, Swasth also operates outreach programs that educate residents about ways to improve health. The founders also developed an IT system that not only categorizes and compiles patient history, but it also includes an app that allows patients to access records and information through their phones. Swasth seeks to reach millions of lives within its first decade.
So I've not met Sandeep for almost 7 years. Then he invited me for dinner one day.
I had been contemplating something to do, trying to do something on health as a social business. And I happened to meet Ankur. One day I called him, invited him for dinner, and we discussed it and said this looks something interesting that we wanted to do, pursue going forward.
I didn't get half of what he said, but as soon as I walked out of the room, I knew this is what I had to do. And that was on a Friday evening when I met him, and on a Monday morning I quit my job. Wow. So it's been a good 3 years with Sandeep. We spent around 4 months traveling across mostly with the western and southern parts of India, trying to understand what it does mean when you say health for all. People in urban areas tend to have a worse health conditions. They have higher STDs in terms of incidence levels. They have chronic diseases are much higher. Because lifestyle conditions of urban areas are much more different. So you have diabetes and hypertension is much higher in urban areas compared to rural areas.
They don't want it free because they think if it's free, then they won't get the right service. In some ways, there's some apprehension about it, and so they like that there is something which is reasonable cost. It's branded in that sense that it assures a certain level of quality of service. Now what we operate in Bombay are 3 health centers where there's a doctor, a nurse, drugs are provided from there at the discounted price, as well as primary healthcare tests, diagnostic tests are also conducted there. But to the consumer, it's a single window place where they get all the services in one place. Right now, we are focused on Bombay, of course, and Bombay is we were doing some very rough numbers. 2011 census tells us Bombay, just the greater Bombay, has a total population of about 30 million people, of which 50% live in slums, or 50% or more. So it's about a population of 15 million lives we are talking of just in Bombay, and that we need to address, which is probably more than some country's population. So we think firstly Bombay itself is a huge market and problem that needs to be addressed.
Because a lot of convincing work also. Finish my job, I always do it.
Out of the it should not be like this and should not be like this and maybe
SCRP is an autonomous organization. Mainly it established in order to eliminate the rural poverty. So in this total 14 components have been working, comprising of health and nutrition, disability, education, gender, insurance, etc.
SERP, which is this Society for Elimination of Rural Poverty, is a very unique organization in the context of any government, because this is the organization which is part of the government system but works on the demand side. Most of the governments work on the supply side, making policies and then implementing it for the benefit of the stakeholders. Whereas this society has been established by the government to look at what are the issues relating to the poor, and also find solutions through the organizations of the poor itself.
The Society for Elimination of Rural Poverty, a government-sponsored and privately run organization, operates in villages across the state of Andhra Pradesh. After receiving training in Jamkhed, SERP staff developed a program where they train health activists to live and work in rural communities. SERP's health activists work most specifically with mothers and young children, focusing on nutritional needs. SERP's programs extend significantly beyond a health focus to include programs on women's economic and social empowerment. This is done through women's self-help groups, where village women gather to discuss issues and brainstorm solutions.
The purpose of this society is to take the responsibility for implementation of anti-poverty programs.
What we have been able to accomplish in the last 11 years in Andhra Pradesh is through SERP we've been able to mobilize and bring about a crore, about 10 million women belonging to about more than 99 million households. We require a local person in the village who is well versed in the fundamentals or the basics of health and nutritional issues, and therefore we've identified from the community the health activist, and then this health activist was actually trained in Jamkhed. The community and we sat together and evolved this NDCC model to take care of the pregnant and the lactating mothers, and importantly 0 to 2 years old children. SERP works in the entire state, and being part of the government system, we are able to sort of scale up every activity in the whole state.
The purpose of establishment of the Society for Elimination of Rural Poverty is mainly to focus on social mobilization. Because in any government program, they will not have that much of time or space to do the focus on social mobilization. Really, they do not take the needs of the community. They just give a blanket instruction which may not be suitable for all the villages or all the communities. So here what the SERP does is it sits with the community and helps them to identify the issues and develop the plans. See, I'm working since 9 to 10 years in this project. So after working such a long time in the project, I'm convinced that neither the public sector nor the private sector which can deliver the services to the last mile. But if you provide the communities with proper training and the support, they can be the best persons to deliver these services.
Rural, rural, as I described, the life is very different. There, I think the poverty traps are more to do with the lack of opportunity, right? So particularly people who don't have land now and who are landless, right? Their entire existence is dependent to a great extent on finding daily wage, daily work.
लहानपणी आम्ही दोघी तिघी बहिणी होतो. आई वडिलाची परिस्थिती होती, खायला कण होतं, मग शिकायचं मग शिकायची इच्छा होती पण शिकवलं नाही. आणि भावाला शिकवले 10वी पण तिला शिकली 4थी आणि मला शिकली 5वी बळच. माझे गावाशी माझं आरोग्याचं काम पुन्हा म्हणजे स्वतःची निगडीत निगडीत म्हणजे असं स्वच्छता बाबतीत किशोरवयीन मुलींच्या गरोदर माता बाळंतपण गावाचं आमचं नातं जवळचं माझं ह्यांचं तर आहेच पण गावाशी सुद्धा निगडीत.
You have poor sanitation, you have water that's stagnant, and mosquitoes breed in that water. You're going to find some of these mosquitoes that are going to carry the malarial parasite, and all of a sudden, boom, you have malaria. Now, what's happening is all over the world, instead of taking care of that sanitation issue, everybody is focusing on providing tents or providing anti-malarial drugs, which why? Why don't we take care of it before it even happens? Comprehensive Rural Health Project, or CRHP as we refer to it, basically has come up with a model for community-based primary health care. And it's a very simple model and very, very efficient.
CRHP's general mission actually deals with three main things, and those deal with empowerment, integration, and equity. But before that, what it really deals with is realizing that health is a fundamental right of all human beings.
So my parents just thought about it, and they just said, well, what happens if we take a local woman and train her to be almost a nurse, informally train her, give her practical training? And that thinking is what revolutionized everything.
Usually, name we give to the village health worker as change agent. We give them scientific knowledge also and time for them to think also. We don't give only health messages, but we give them behind the whole story, and we don't push our thought on them.
The wall.
The Comprehensive Rural Health Project in Jamkhed uses a structure based around three main components. The village health workers is the cornerstone of CRHP's approach. A woman is chosen by the villagers to serve as an informal health provider and act as a liaison between the community and CRHP. She addresses basic health needs, provides health education, and supports the overall health of the community. The mobile team is made up of CRHP social workers and doctors who travel around to the villages and support the village health workers. They treat diseases that require medical intervention. The secondary care facility, Julia Hospital, provides advanced treatments in general, gynecological, pediatric, and orthopedic services. On campus, CRHP also operates a number of specific programs like farmers' clubs and adolescent girls and boys programs. CRHP's approach revolves most importantly around listening and working with the community instead of for the community. The philosophy includes giving the people the tools to make their own change and development.
My parents, both of them were trained physicians. They had also studied public health in Johns Hopkins, and they had looked at various models. And while studying and learning and living with the communities, they understood that health is not isolated. And especially in rural India, there are other things that really affect health.
Health cannot be isolated from the other factors of life. So health is related with economy, environment and education. CRHP's program are from the community. Many of the time, some of the organizations, they work with the community. For CRHP, both community and CRHP is working together.
We're dealing with knowledge which can be shared by all people, and we're dealing with understanding the cultural sensitivities of each country. And so, because we understand at a deeper level than just saying you give vaccines and the whole world will be free, or there's no quick fix for things, that's why we have such a global impact.
And to answer to your question, I think it will be multiple organizations, and I think it's coming from at least our belief that India is a million India. There is not one answer that will work across India on something like health. So it has to be very localized solutions.
She's in 11th class. Then she will complete the 12th class.
There's no reason anywhere in the world that health should be denied. And so with CRHP, we look for ultimately that the CRHP's life ends when there is health for all. And that is what CRHP wants to ensure, that there is health for all throughout the world, not just India.
I think NGOs, private sector all have a role. I think each is complementary other. It can't be just one or the other. I would believe that each one addresses sectors which is not addressed by the other. So I think all the three have to live in harmony.
At some point or the other, the people need to have the information, the knowledge, and they should be empowered enough so that they can take health into their own hands. And the ultimate that you should get out of that, or community should get out of it, or other organizations should get out of it, that is health for all. So that health is a basic necessity. It is like water. It should not be denied.